President, I rise to address the nomination of Cornella Pollard for the District Court, D.C. District Court. This nomination is a good example of government overreach that's led to things like the Obamacare debacle. And let me say to my colleagues who have been on the floor talking about Newtown, I had the opportunity to spend an hour with parents of Newtown children. What a compelling personal story that they shared. And no parent should have to watch a child die. No parent should have to live and a child die. And my heart still goes out to those that lost children at Newtown. Mr. President, today, with the Affordable Care Act fresh on my mind, I ventured back to think about what I came on the floor in 2009 and said in front of my colleagues in the United States Senate and to the American people. And I'd like to spend the balance of this second half of hour sort of rehashing some of the things that I came to the floor and talked about. There were numerous opportunities before that legislation was passed. If I remember, very close to Christmas in December of 2009. I said this: premiums will increase for younger and healthier individuals because the new federally mandated rating rules. Over 40% of the uninsured are ages 18 to 34, the same group that will be hit with the highest price increases if this bill passes. What do we hear Americans focused on today? Young people, are they going to join? Today, their insurance is 3 times lower than what it's going to be in January of 2014. Why? Because of the Affordable Care Act. 2, premiums will increase because of new federally mandated insurance standards. Experts estimate many of the health plans purchased today by individuals and small businesses will not meet the minimum requirements mandated by this bill, which means that all Americans will be forced to buy richer plans. Let me remind those that are listening, this was in 2009 on the Senate floor. Listen to the comments of those today that say, well, we never anticipated some of these things would happen. If they didn't anticipate, it's not because people weren't on the Senate floor, and it wasn't because we made this up. It's because people who were experts, CMS actuaries, CBO administrators, were sharing with us what would happen if this legislation became law. Premiums will increase because new federally mandated benefit packages. The bill empowers the Secretary of Health and Human Services to decide which benefits are covered and which benefits are not. What are Americans learning every single day now that they can get on the exchange? They're finding that they're 60, 65 years old and they've got to have maternity coverage. Well, Mr. President, let me say, I just turned 58. My wife has pretty much informed me we're not going to have any more children. But I can't buy health care without maternity coverage. Why? Because they want to charge me more to shift that cost. We didn't have health reform. We just changed where we're shifting the cost from. Now we're embedding the cost in the premium versus charging more at the delivery point of health care and shifting it within the delivery system. Now we're shifting it within the population by charging those of us that are a little bit older more because we mandate that we've got to have services we're never going to use, and younger people are healthy that probably are never going to need to go to the doctor. I hope they do, because prevention is actually one of the most beneficial things that we can promote. But now we're going to charge them 3 times what they were paying, and we believe that they'll take it? Premiums will increase because the new excise tax on medical devices. Innovation is what saves health care dollars. Yet in the Affordable Care Act, or some call the Obamacare, we actually put new taxes on medical devices. So every time you've got a stent that's inserted, every time there's a medical device that's used on you, your health care bill goes up, because we've now taxed the device that they're using. Well, if the device goes up, if the price goes up, if the reimbursement goes up, the premium goes up. It's starting to make some sense. This again is in 2009 before we passed the bill. Premiums will increase because of a new excise tax on health plans. We actually taxed the same health plans that are in the exchange that we told everybody would save them money. Premiums will increase because the new excise tax on prescription drugs. But wait a minute. I thought we were bringing down the cost of health care. In 2009, again, new taxes on devices, new taxes on health plans, new taxes on prescription drugs. These were all things that we all knew. The president knew it. My colleagues that voted for the plan knew it. But everybody seems to have amnesia today. Oh my gosh, how could the cost go up? I never knew that this was going to require people to buy a health insurance policy that had benefits that they would never use. Premiums will increase because of a new fee to sell plans in the mandated exchanges. This phenomenal exchange market that we created competition, we now created a new fee to enter into it on the part of insurers. Premiums will increase because of a new tax for comparative effectiveness. Comparative effectiveness means that we're trying to bring new generics, whether they're in pharmaceuticals or biologics, to the marketplace, and we've decided to tax that process. Premiums will increase because the bill forces 15 million more Americans to enroll in Medicaid. Why does that happen? It happens because doctors are paid so little on Medicaid that they have to charge more for everybody else. So we're cost shifting when we purchase the premium, and now all of a sudden we're learning we're cost shifting even when the service is delivered. Reform? No. 2009, again, I came to the floor and I talked about the Affordable Care Act, Obamacare. 0 times did it mention provisions prohibiting the rationing of health care. 0. 9 times it mentioned new taxes created in the bill. 13 pages in the table of contents. The bill weighed 20.8 pounds. 36 pages it took for the CBO to estimate the price tag of Obamacare. 70 government programs authorized by the bill. 1,697 times in the Affordable Care Act, the Secretary of Health and Human Services was given the authority to create, determine, and define things in the bill. A bureaucrat that we allowed 1,697 times to determine what Congress' intent was in the legislation. Almost 3,000 pages. 3,607 times the word shall. Not may, shall were in the bill. $6.8 million cost to taxpayers per word. I remind you, this is what I came to the floor and talked about in 2009, before the United States Senate passed this legislation in the dark of night. 24 million people left without health care. This is the bill that was supposed to insure everybody. 24 million people without health insurance. $1.2 billion cost to the taxpayer per page. $5 to $10 billion of additional funding needed for IRS implementation of the bill. In other words, we're going to fund $5 to $10 billion for the IRS to chase down people that owe a penalty because they made a determination, I can't afford or I don't need health care insurance. $8 billion in taxes levied on uninsured individuals. Now, there's a way to make health care affordable. Tax people that don't have it. $25 billion of additional Medicaid mandates placed on states. $28 billion in new taxes on employers not providing the government-approved plans. $100 billion estimated annually of fraud in Medicare and Medicaid. $118 billion in cuts in Medicare Advantage. to seniors all across this country that found the product to be the one that provided the most security and benefits for them. $465 billion in cuts to Medicare. Cuts to Medicare. A healthcare system that was at that time projected to be insolvent in 2017. $494 billion in revenue from new taxes, fees levied on American families and businesses. $2.5 trillion cost for full implementation of the legislation. At that time, Mr. President, we had a $12 trillion debt. Today, $17 trillion debt. Health care was supposed to be more affordable because we reformed it. We didn't reform it. We took it over. The federal government took it over. Let me go to another process that I talked about in 2009. It's all marked up. It's been in my desk drawer since then. It's a word search of the bill. 4,677 times that legislation said shall, must, or require. 899 times it said tax, fee, or revenue. 470 times it said agency, department, commission, panel, or bureau. 196 times it said regulate or regulation. 134 times it mentioned treatment. 180 times it mentioned prevention. 40 times it mentioned choice. 25 times it mentioned innovation. 13 times it mentioned competition. You know, if you listen to those that are out selling this awful plan today, words you hear: choice, innovation, competition. Those things mentioned least in almost 3,000 pages of health care legislation in 2009. This bill wasn't reform. This bill spent trillions of dollars at a time of record deficits and debt. When fully implemented, I said then, this bill is projected to cost $2.5 trillion over 10 years. CBO said at the time, this bill will increase federal health costs, not lower it. What have we heard the president? It's going to lower health costs. It's going to bring it down. It's going to be more affordable. Middle class, this is the greatest deal for you. The bill raised taxes by more than $500 billion at a time of record unemployment. The bill violated the president's own pledge to protect the middle class. Who gets taxed in this bill? Again, this is in 2009 on the Senate floor right here before the vote. Uninsured Americans, insured Americans, families with high-value insurance plans, high health costs, small business, individuals who need medicines or medical devices, and employers that provide retiree drug coverage. Employers that provide retiree drug coverage, we taxed them. The bill cut $466 billion in Medicare to fund new government programs. Medicare faced at that time a $38 trillion underfunded liability and insolvency that was projected to be 2017. Instead of fixing those problems, this bill raided Medicare to start a new government entitlement. The bill cut Medicare Advantage, it cut hospitals, it cut nursing homes, it cut home health, it cut hospice. Nobody in the administration can go out today and say, oh my gosh, we didn't know this was going to happen. We talked about it right here, day after day after day. These are not things that we made up. If we did, we would be prophets, because they're all coming true. Everything is aligning with what we said. The bill would increase premiums, making care more expensive, not less. I mean, let's get past what was the easy part, and that was setting up the exchange, setting up the website, or at least it should have been. New taxes in this bill will get passed on to consumers, increasing yearly premiums. This is what I said then. Listen to this. By $488 a year, according to some estimates, the average premiums would increase by $2,100 for a family policy in the individual market. There are individuals that are seeing $488 a month in increase. And in addition to that, a deductible that they've never had applied to them before. This bill imposed costly new burdens on struggling states. The bill threatens health care choices millions now enjoy with a tangled web of new rules, regulations, and government-run plan. The government will require you to purchase insurance or face a fine. And will tell you what kind of insurance you have to have, even if you like what you currently have. Mr. President, I'm not a prophet. I was going by what the experts said reading the bill. So for everybody that went out and said, if you like your insurance, you can keep it. If you like your doctor, you can keep it. If you like your hospital, you can keep it. We were on the Senate floor saying, it's not what the bill says. It's not going to happen. This bill cut $130 billion from hospitals, $120 billion from 11 million seniors on Medicare Advantage, nearly $15 billion from nursing homes, nearly $40 billion from home health agencies, nearly $7 billion from hospice. Cutting Medicare to fund a new government program, in my book's not reform. It's ignorance. The CMS Office of the Actuary. Now, let me tell you, the actuary is like the gold standard. The CMS actuary is like the guy who puts that stamp of approval on and that there's nobody that's higher from a standpoint of what the actuary said. He said the bill increases national health expenditures. National health expenditures under this bill would increase by an estimate of a total of $234 billion. 0.7% during 2010 and 2019. It's exactly opposite of what everybody's out saying today. Despite promises that reform would reduce health care spending growth, the bill actually bends the health care curve upward. According to the analysis, the national health expenditure as a share of GDP is projected to be 20.9 in 2010 compared to 20.8% under current law. How could you go out and make a claim that this was bending the cost curve down? How could you promise the American people that it was going to be cheaper? The total number of persons with employer coverage in 2019 by the CMS actuary pre-2009 when the bill was passed to be 5 million lower under the reform package than under current law. Let me say that again. CMS actuary told us in 2009, before we passed this bill, that employer-based coverage would drop 5 million additional covered lives. And I might say, Mr. President, some estimates are coming in at 100 million employees losing their health care under employer plans right now. The new fees for drugs, devices, and insurance plans in the bill will increase prices, health insurance premiums, costs for consumers. This will increase the national health expenditure by approximately $11 billion per year. The bill funds $930 billion in new federal spending by relying on Medicare payment cuts, which are unlikely to be sustainable or permanent. As a result, providers could find it difficult to remain profitable, and absent legislative intervention might end up their participation in the Medicare program, possibly jeopardizing the care to beneficiaries. See, it wasn't Republicans that talked about rationing. It was the actuary at CMS. In his analysis of the Affordable Care Act, he said, here's what's going to happen. And it's seniors that are going to get hosed on it because they're not going to have access to the doctors anymore. The bill is especially likely to result in providers being unwilling to treat Medicare and Medicaid patients, meaning that a significant portion of the increased demand for Medicaid services would be difficult to meet. How could anybody listen or read what the CMS actuary said and remotely go out and tell the people, geez, this is going to increase coverage for everybody? CMS actuary noted that the Medicare cuts in the bill could jeopardize Medicare beneficiaries' access to care. He also found that roughly 20% of all Part A providers, hospitals, nursing homes, etc., would become unprofitable within the next 10 years as a result of these cuts, meaning they're going to go out of business. You know, pretty soon it's not going to be the network that the insurance provider put together. It's going to be the fact that the hospital went out of business because they couldn't withstand what this bill has done to them. CMS actuary found that further reductions in Medicare growth rates through the actions of the Independent Medicare Advisory Board. Now, that's going to sound a little odd to some because prior to the bill passing, it was called the Independent Medicare Advisory Board. It's now called the Independent Payment Advisory Board, IPAB, an entity that was set up that when it's kicked in, 16 members picked by the president, they will determine reimbursement, scope of coverage. It's not the Congress of the United States. If we don't legislatively do something with their recommendation, it becomes law. It goes into effect. The bill would cut payments to Medicare Advantage plans by approximately $110 billion over 10 years, resulting in less generous benefit packages and decreasing enrollment in Medicare Advantage plans by about 33%. 33% of seniors would lose their Advantage plan. And again, Mr. President, this is 2009. This is not today. Higher cost, President in 3,000 pages said it would reduce cost. Chief Actuary says that's not the case. Mr. President, let me read a letter. A letter I got the last couple of weeks from Lori Perez, Willow Springs, North Carolina. I'm a divorced mom of 3. I received insurance through my employer. My rate has increased $100 a month. This is a huge difference that will have to be budgeted by reducing groceries and foregoing my son's braces that I had planned for 2014. I looked into dropping my company provided insurance, joining an exchange, but I don't qualify to receive a subsidy because my insurance rate's less than 9.5% of my income. It's 9%. My yearly income qualifies. Apparently, Obama thinks I can afford an additional $1,200 a year. I'm considering dropping my insurance, paying out of pocket as needed for health care and paying the fine at the end of the year. It'd be less expensive. This is ridiculous. What can I do? What do you say to Lori? Oops. That's the law? Here's somebody who was 100% satisfied, an employer doing the right thing. And the federal government has now put her in a situation that she's considering just giving up her health care, doing away with it. Why? Because she can't afford it. This is a woman with a job. She's thinking about giving up her groceries, delaying her son's braces. Why? Because of Obamacare. Where are we today? Let me speed forward. Well, I said that we've got the healthcare exchange, the healthcare.gov, the website. Now, there are companies every day that get websites set up. This one is complicated. They had 3 years to do it. It's still not right today. But I'm convinced they'll get it right. But for the first time, the American people are getting ready to, they're getting on the website and they're able to look at these health care options that they've got. And what are they finding? They're finding the premium cost for something that equals what they had 2 times, 3 times more expensive per month. They're finding this new thing that they've never had before. It's called deductibles. And I'm not talking about a $100 deductible that you have to pay before you get some participation in a doctor's visit or an emergency room visit. I'm talking about $1,000, $3,000, $5,000. I've heard from friends that they've now signed up for plans that have a $15,000 deductible. Geez, I say to my colleagues, especially my colleague from Florida, sounds like a health savings account, doesn't it? You got insurance, but you're responsible for the first $15,000 of it. Well, the guy that shared that with me, his premium is $1,444 a month with a $15,000 deductible. I don't think he's going to drop it, but sticker shock is rampant. Benefit package. How many people have come up to me and said, I'm not going to have any more children, but I got to have maternity coverage. Something's wrong. They're right. Something is wrong. How many kids would like to have a scaled down thing that allowed them to have this set of benefits, and they're willing to roll the dice on if something bad happens, they'll pay out of pocket? No, they don't get that option. Choice does not exist unless it's the choice of the things that were created in the Affordable Care Act. Networks. This is one American people haven't gotten to yet, and I can't wait till it happens. I've gone through getting on the DC exchange, going through the process of trying to figure out, is my doctor in North Carolina available under this plan or that plan? Wait until the American people get into healthcare.gov and they start picking a plan and they look to see, is my primary care doc on there? Is my hospital on there? Is the specialist I see on there? Are the drugs that I take on this plan? I mean, this is incredibly complicated. And the American people were used to calling their insurance broker and saying, hey, here's how much coverage I want, and here's how much I've got to spend, and here's my health condition. And they sort of designed a program to meet their health condition, their income, and their age. Now, we penalize you for your age if you're old or young, and we force everybody to take the same benefit package regardless of whether you can afford it or not. And we say if you don't get it, we're going to charge you this year a 1% penalty on your income. That goes up to about 2.5% at the end of the transition period. Well, we're going to get past this period, which I call the enrollment plan period. And next, we get to the part that the president delayed. You see, we never understood that something that was in statute, the executive branch could just decide, no, it's not going to go into effect. But for large and small employers, they had a one-year delay. And all of a sudden in 2015, their employees are going to be in the same marketplace that we are. What makes that particularly difficult is that we extended the enrollment period for individuals in healthcare.gov until March 31st of 2014. They can still enroll. Well, April 1st of 2014 through April 27th of 2014, insurers have to decide what their premium cost is in 2015. But they have no real experience on what the mix of ages and health conditions in their plan are. What are they going to do? They're going to err on the side of higher premiums. That's higher than what we're seeing today in 2014, which a majority of the American people say are higher than they can afford. Imagine what it's going to be like in 2015. And in that group is the 80% of America, not the 5 to 10% that are provided for by employers today. Mr. President, I see my colleague here, and I'm infringing on his hour. But I do want to stress one last thing. I mentioned only once the Independent Payment Advisory Board, IPAB. At the end of the day, mark my word, everything that I commented on, I read from my 2009 notes. Notes that I came to the floor then and said, this bill shouldn't become law, and here's why. I spent 5 minutes talking about today. But I'm going to make this statement, and I'll come back to the floor 2 years from now when IPAB's up and running, and the benefit packages have been cut down, and the reimbursements have been cut to doctors and hospitals, and I'll point to the statement that I made here, that picking a 16-member advisory panel that has the authority and the power to set the scope of coverage and, more importantly, the reimbursements will have the most devastating effect on health care in this country. It will ration health care because of the doctors that choose not to participate in plans that participate in the exchange. It will force hospitals out of accepting plans that participate in the exchange. And for those of us that are forced by government to be in the exchange and to choose, our choices will be gone. Our costs will go up. Yeah, we'll get when we're queued in line, or at the emergency room, or from a doctor we don't know or don't trust, or from a hospital we have to drive to see. Not going to be a reassuring thing to that mother who now has maternity coverage and no obstetrician, no local hospital to deliver a child. Because you see, we didn't reform health care. We didn't do anything to liability. We just changed the pocket we pay out of. We've taxed everybody we could find to pay for it. And still, as I said in 2009, and I believe will be true today, at the end of this process, there'll be 24 million people without health insurance. Why? Because of Obamacare. Because of the choice or the lack of choice that we gave them. I yield the floor.